we look at a normal dog to start with, looking straight down at the leg. The three bones that make up the leg are the femur bone here, the tibia down here, and then the patella that sits on the end of the femur.
Right.
The other structures that are important are the quadriceps muscles here, which come down and attach to the patella, and then the patella continues down and attaches to the tibia right at the front of the shin bone here. So normally, if you look from the shin bone up through that muscle, everything is pretty much in a nice straight line there, the way that runs. And there's a nice little groove on the end of the femur. So when the quadricep contracts, that pulls on the patella, that straightens the knee. And there's no reason for the kneecap to ever move inward or outward, medially or laterally.
Right.
So that's what we should have. Now, when we have these dogs with congenital patella problems, typically they have kind of a varying degree of deformity of their leg.
So like they're born with this.
Right. Or with a tendency for it. They usually don't have it at birth, but they get it as they're developing.
Sure.
The first thing we notice is they tend to have kind of bowed femurs, and their toes tend to turn in a little bit. So right away you can start to see what's going to happen here. The shin bone is shifted in, the femur is curved, and the muscle's up here where it should be, but the line in between those two is off-center now. It's not sitting over the end of the femur. So the kneecap, by nature, wants to slip off to the inside. When that happens, this groove on the end of the femur never forms correctly or gets worn down, and so even when we push it back on, the patella just keeps slipping right back off to the inside there. So that's what we're dealing with at this point. A lot of times by this age also, there's arthritis because the cartilage is damaged and there's bone on bone in certain areas. So the goal of surgery is going to be to realign this and give him a better place for this patella to sit. So the first part of the surgery is we actually look at this cartilage on the end of the femur, and we'll cut a little groove in the bone to create a better spot for that patella to sit. So now he's got a place for that to sit. Then the next part, and probably the most important overall, is we'll actually cut the shin bone. So we cut it in this plane like this, and move the shin bone over this way just a little bit. Hold it there in that new position with a couple of little pins that we put in there. And remember, that's attached to the patella through the patellar tendon, so the whole thing gets shifted over this way. Now when it's all lined up, it should stay in the groove where it's supposed to and not pull off to the inside.
Okay.
Now these little pins, those are the whole purpose of those is to hold the bone there while it's healing. So we need to keep him quiet while he's healing so that he doesn't do any damage or pull that bone apart. Usually those pins just stay in forever unless they're causing him a problem. But it is right under the skin. There's no meat over the shin bone. So if those pins start to irritate him or back out at all, sometimes we'll have to go take them out later on. It's not a big deal if we have to. It's just a minor procedure.
So I have a question. So you said something about bowed legs. So Taz has long back legs, and he's always like sat like this when he sits down.
Yeah.
Does that have anything to do with it?
It might be the way that just the way that his tibia is kind of curved.
Like he sits like a frog, and I've always like joked, oh, it's so funny because when he sits on his butt,
he doesn't look
sits
terribly
like this.
bowling. In some of the dogs, you can really see it on more than others.
It's okay.
But obviously, we take X-rays before we start and
Sure.
get everything all figured out from how it looks on an X-ray too.
Okay.
But that's kind of the overview. They stay overnight one night for mainly pain control. We know that first night's going to be sore, and we do everything we can to prevent pain as much as possible. We get an epidural, so he's not feeling a lot of pain when he first wakes up, and then as that wears off, there's somebody here with him all night to give him morphine as they need it and so forth. So they're never left alone. But usually by the next day, he'd go home with just the oral medication then and be able to be managed with just oral medication.
What are you going to send him home with tomorrow?
He's on the Rimadyl and ACE now, so we keep him on the Rimadyl. We add in a drug called Tramadol, and probably keep him on the ACE too. So yeah, we'd just be adding Tramadol.
Keeping in mind that he doesn't sedate well?
Yeah, I mean, he doesn't necessarily need to be super sedated. Okay. He can walk on it from day one if he wants to. We just don't want him
leash walk, right?
Yeah.
And you're sure? I mean, like, he's my baby. He's my fur kid. Like, you're sure you're okay with anesthesia and he'll be fine?
Well, I mean, we're never sure 100% on anything, but we're going to run blood work on him, make sure it looks good. We always do that. If the blood work's good, and he's he's not an old dog, he's just sort of middle aged, and so there's no reason to think he's at a high risk. The good news is the surgery is a fairly common surgery, so